My name's Mark Allen, one of the thoracic surgeons at the Mayo Clinic, and we're here with some of my colleagues today to discuss the Annals and the celebration of the 50-year anniversary. So let's start by introducing ourselves, and we'll start with Dr. Ferguson.
I'm Mark Ferguson. I'm a thoracic surgeon at the University of Chicago. I've been on the editorial board of the Annals for 8.5 years, and I'm the current deputy editor of the Annals.
I'm Alec Patterson. I'm a thoracic surgeon from Washington University in St. Louis, and I'm soon to become the editor of the Annals of Thoracic Surgery.
I'm Hank Edmunds. I was a cardiothoracic surgeon at the University of Pennsylvania, and I am the current editor of the Annals.
So Hank, you're the outgoing editor. How long have you been the editor?
15 years minus an hour and a half.
Tell us some stories about some memorable activities that the Annals has gone through.
I inherited the journal from Tom Ferguson, who was editor of the Annals for 16 years and presided over the tremendous growth of our specialty in cardiothoracic surgery, both the cardiac side as well as the general thoracic side. And so I inherited a very strong going concern. But I also inherited the internet, which wasn't used very much by Tom Ferguson and Carol Blasberg as managing editor. So I started with a whole bunch of new tools, and in our second year, Heidi Pasai, who is my managing editor, and I were able to put the Annals on the internet.
In the time that you've been the editor, what do you think has been the biggest change in content or means of communication? What do you think the biggest change has been over that 15 years?
There's change going on in our specialty all the time. And the Annals records that change and disseminates the information to our colleagues all over the world.
Let me give you a practical example of how some change has occurred. So I was a deputy editor for a different journal prior to joining the Annals for about 20 years, and I literally had a file cabinet 4 drawers high filled with manuscripts. And because of the changes that Hank's describing now, there's no paperwork at all involved. And it's a much more streamlined process and a much more rapid process. So authors and readers benefit from some of those changes to electronic media.
Yeah, I was a deputy editor or associate editor in those days for another journal in the era of fax. And we were swamped with fax paper. Yeah, it's been a major change. And you might want to comment, Mark, you were kind of instrumental in helping develop or helping push along this new enterprise in China. You want to talk about that a bit?
Sure. I mean, I wouldn't say I was instrumental. I just happened to be in the right place at the right time. But we've had an ongoing interest in interfacing with some of the large populations that haven't had adequate access to Western medicine, or our journal in particular. And China is, of course, the biggest example of that. You could call it a big market, depending on which facet of the Annals we're talking about. But they've had a long-standing interest in having more access to Western articles, and I think the Annals is the absolute best vehicle for that information, just because its size and reach and quality. The problem is that unlike some Asian countries, India and Japan, the penetration of English is very poor. And so what I help do is identify and vet an editor for thoracic content, and that person had chosen a really good group for their editorial board. I met with them and we talked at length, and it seemed like everybody was on board with the concept and how to go about it, and it looked like they were going to produce a quality product. And so when I brought that information back to Hank, I think that helped launched that effort?
Well, when we finally got the Annals on the internet, I realized that we now had an opportunity to improve the quality of each manuscript, particularly when it was written by someone whose native language was not English. And this was a big problem under Tom's supervision. And what it allowed is that I did an experiment, which I won't describe, and then finally concluded that the language editing, a term we coined, needed to be done at the source of the article. In other words, the author of the article needed to sit down with a native English speaker or someone who was fluent in English who also spoke their language, and go through the manuscript and correct the English grammar, syntax, because English is a tough language. And that made each article readable and therefore improved the understanding of the articles in the English. That was one of the very early benefits of getting on the internet. I could have this two-way conversation, so to speak, with the authors, and we weren't waiting for a ship to sail or an airplane to get off the ground.
Well, you've also added a number of really talented members of the editorial board from all over the world. Europe, Asia, China. There's two Chinese on the editorial board.
Well, Tom added the first non-North American on the editorial board. I don't remember his name or the year, but it's in the summary. And but we just were following in the wake of this entree, but we had to improve the transmission of the author's message, and the internet made that possible. And when I took this job, I realized after a month that this was probably the best teaching job I ever had, because none of these surgeons knew how to write a paper. I mean, they didn't know how to design a study. They were clinical doctors. And so that in the review process, there was an opportunity to teach young surgeons how to ask a question, how to find an answer, and to address issues that no one knew the answer.
A prospective author out there who's watching this, what would you tell that person who's writing a paper and he wants to send it to the Annals and get it published? What sort of thing does the editor look for a good paper?
I read the introduction. I read the abstract. I look at the introduction, I look for the rationale, and I look for the hypothesis or purpose of the paper. I have to say that it's lacking in half of them. Then I look at the data. I look at all these papers follow a form, the methods. And I look for who are the subjects, patients, okay? What are you going to measure in these patients? Survival, complications, just what are you going to measure? So you have to describe the patients you're studying. You've got to identify the outcomes. Well, you see the process is step by step, one step leads to the next. In the statistical analysis, which is vital now because statistics is such a powerful tool. And I look at see whether or not they have a statistical. Logistic regression has just been tailor-made for surgeons. And then the discussion, I don't look at that much.
Well, Hank, you've always made a very strong point about the educational value of your job, and you've been a very strong proponent of that in virtually every editorial board meeting that I've attended and every phone call I've ever had with you. But I'd like to know, when you took the job, that was a big opportunity. What was the biggest challenge that you faced?
When the job actually lands in my lap, as Alec will feel next week, then you realize that you have a very, very big opportunity to communicate with everybody that does our work everywhere in the world. You get to connect with all our colleagues, and you work as partnerships. You know, I want to publish your papers, but you and I both want to make them good. It all follows from that, I think, Mark.
Yeah, maybe that famous quote of Dr. Sloan, you know, that appears on the masthead about this is a vehicle or a place where all thoracic surgeons can report their experience for the benefit of other, can share information for the benefit of other thoracic surgeons as they look after their patients. So it seems to me that the paper's got to be of interest to and an opportunity for others to learn from.
Well, Mark, what do you think? You've been on the editorial board for several years now.
Yep.
And you also initiated a very good symposium in March, you know, the General Thoracic Surgical Club. And I've had a lot of fun going to those meetings to learn about general thoracic surgery, which I sort of faded out as it got harder and harder.
I must say, though, as a reviewer, I like your summary, that you read the abstract, you get a sense of what the paper is going to tell you, and then you read the introduction, and you want to see a clear statement that says, this is why this paper is important. Yeah. And then it gives you the methods, which is usually pretty straightforward, and then a clear presentation of the data that's not confusing. And for me, when I review a paper, that's what I look for, and that's a good paper.
Yeah, if the paper has good data, you just have to help guide the author in the presentation of the data.
All right, I think that, I don't actually, don't you think that the average trainee now, the average young surgeon has a much better concept of writing papers than they did 20 years ago or 25 years ago?
Absolutely. You could go back 40 and I can tell you it was even worse then.
Yeah, I think there's been a big change.
Much better examples now. They're learning by reading.
Yeah,
so,
true.
you know, I'm going through one of the first issue papers now to prepare a commentary.
But you all are thinking U.S. and Canada. You're not thinking all the other places where papers come from.
Yeah, you're right.
And they don't have the model. They don't really have the concept of what makes a good paper. What we're really trying to learn from your experience with your patients.
You introduced the concept of the 50th anniversary celebration. So Mark was about to describe writing a commentary on a very interesting, important paper that was published in the very first volume in 1965.
Yeah, so what I was going to say about that and about the way to go about writing a paper is that those papers are much different than the papers we see now. So they're very conversational, they're very anecdotal, and they're very unobjective in presenting their data.
Not many figures or tables.
Yeah, and you can't get away with that anymore.
Well, now don't be too hard on the pioneers. You know, when a new journal, you're not going to put your best work in. And Steele, Dr. John Steele, who started the journal, and Herb Sloan, their task was quite different from Tom's and mine, and more like what I think Alec will be, but boy, you never know, Alec. And
well, I understand your point, and I don't disagree, but reading all of the journals from that time period, and maybe, you know, the 50s included, that's the way articles were written in those days.
That's right. They were basically almost conversational anecdotes.
Yeah.
But you know, so is thoracic surgery. I mean, you know, you're learning that too.
But they were writing, that's true, the quality of the papers changed over time. If you look at what was written in '65, and we've identified landmark papers through the entire 50 years of the journal, it changes a lot. But what they were talking about and writing about in 1965 were important issues then, and they're actually, many of them, still important issues.
Alec, you're taking over in looks like a couple hours
Yeah.
of the journal.
Yeah.
And what do you see for the future for the Annals?
Well, the immediate future, we want to really recognize this 50th anniversary year. So you'll see some changes to the cover of the Annal. You change some changes to the content. We're going to honor those early publications of 1965, and we've identified a series of landmark papers in the remaining years of the Annals to focus on those in each issue, and have one long commentary on a 65 article and 3 shorter commentaries on other landmark papers as the history of the Annals unfolds. Beyond that, and I've talked to the STS about this, I think that the Annals could take advantage of many of the scholarly activities of the STS, the database, for example, the public policy work that's being done, education. So we're going to focus on that, and I think there's ways that we can make the Annals content more portable, more of its content on the internet, on mobile devices that all of our trainees are using, and us old guys are kind of dragging along behind trying to figure it out.
Well, you know, it's already, the apps are already out.
Yeah, so
But they're just started.
Right, they just started, and in fact, I think the Android version is not yet out, but it will be soon, and we're learning a lot. And I think your colleague Shanda is going to help a lot with the application of those technologies.
We're trying to build some excitement with Facebook and Twitter.
Right.
And,
Correct.
you know, because I think that's where the younger generation
and
really looks to get some
and
information.
those stuff's going to change constantly, as Hank said earlier.
Well, don't forget the portability of the new instruments, so that a resident or even an attending can, on rounds, pull it in his pocket, pull out, and pull up an article that's relevant to the patient in that bed.
Yeah, it's true. Yeah.
Suits the current generations of learners very well.
Just-in-time learners.
Yeah. So you've described a lot of opportunities. So I'm going to ask you the same question I asked Hank, which is, what's the biggest challenge that you see in the first 5 years or so?
Well, one challenge I see is me, who I am. I'm a thoracic surgeon. Hank was a cardiothoracic surgeon, and I don't have a great knowledge, although I've been a chief of cardiothoracic surgery in a big institution. I don't have an intimate awareness of cardiac surgery or congenital heart surgery, and that's one of the reasons why I augmented the deputy editor composition of the board, because I really need help with that sort. So for me personally, that's going to be a bit of a challenge. And I think there will be other challenges partly related to making the content more portable, putting more material on an e-version. For example, move all the case reports, for example, onto an e-platform. So I think those are all going to be challenges. And I suspect that within my tenure as editor, the paper version is going to disappear and will be digital totally.
Do you want to talk about the new staff that's coming to Chicago? We have a new managing editor.
We're developing a new editorial office at the STS headquarters in Chicago. We're hired a terrific managing editor and another member to join her, and there'll be 2 other hires very soon. So we'll pretty soon have a full-time complement of 4 editorial staff members at the headquarters in Chicago. I think we're going to.
Well, the handover is a phase thing, and because if we were to drop the full load on Alec's team, it wouldn't be fair and it wouldn't work out for anybody.
The annual meeting.
So it's a very carefully choreographed handover that is going to be taking process in the next few months. We want them to succeed every bit as they can, and we also are a little bit closer to what the load is.
Okay. Well, Mark, Hank, and Alec, thank you very much. We really appreciate your time.